My name is Taylor Boudreau. I'm here to do my head-to-toe assessment. So, my name is Taylor Boudreau. I'm a nurse practitioner student at Auburn University. So I'm going to be doing a head-to-toe assessment on you today. I'm just going to be observing his general appearance, his grooming, his hygiene, noting any body odor, his overall appearance. He appears well-nourished, well-groomed. He doesn't appear to be in any acute distress. His gait, posture, and all of that appear normal. So with that, I'm going to perform hand hygiene, provide privacy. His height, weight, vital signs, and all of his labs and BMI are all within normal limits. So we're going to move on. For the sake of this exam, I am going to let him stay in his clothes. For a clinical exam, I would have him change into a gown, but for this, I'm just going to let him wear what he's wearing. And also for the sake of this video, I'm going to be assessing one side of the body for most of the systems to save on time, but I will verbalize normal findings for both. So we're going to start with the head. So I'm going to be observing the head, the skull, the scalp. If he had hair, I would be looking at distribution and looking for signs of infestation. He does not, so I'm going to be focusing on the skin. I don't notice any redness, irritation, bruises, bleeding, swelling, deformity, or anything like that. So next I'm going to palpate it for tenderness. Is any of that tender? Good. So next I'm going to move on to the temporal and maxillary sinuses and palpate those for tenderness. Is that tender?
Mm-hmm.
Good. I'm going to palpate the lacrimal duct. Is that tender?
No.
Good. So next I'm going to move on to palpating his temporomandibular joint just at rest. Is that tender? Good. Can you open and close your jaw for me? Good. So no crepitus noted. It opens and closes nice and smoothly. So next I'm going to have him clench his teeth. Good. So his masseter and his temporal muscles contracted and or tense. So that tells me that cranial nerve 5 is intact. His face at rest is nice and symmetrical with no drooping or anything noted. So I'm going to test for cranial nerve 7. I want you to raise your eyebrows for me. Close your eyes real tight. Smile really big, showing both sets of teeth. Stick your tongue out. Move it side to side. That's cranial nerve 12 is intact. And puff out your cheeks. So cranial nerve 7 is intact. So that's a normal finding. Just looking at his eyes, his eyelids are symmetrical with no drooping, redness, or swelling noted. His eyelashes are intact. His sclera is nice and white. His cornea is nice and clear with no signs of abrasion or cloudiness. His conjunctiva is nice and pink and moist. His irises are nice and brown and round. All of that is a normal finding. So we're going to move right along, and I'm going to start with the pen light exam, looking for corneal light reflection, direct and consensual pupil response, and accommodation. So first we'll do corneal light reflection. So shining at the bridge of his nose, I see the light reflected evenly in both eyes, which is a normal finding. So next we're going to look for direct and consensual pupil constriction. Good. So the pupils respond equally to light. They constrict equally, so that's a normal finding. So next I'm going to have you follow my pen to the bridge of your nose. And so his eyes did cross, which is positive for accommodation, so cranial nerves 2 and 3 are intact. So next I'm going to do the extraocular movement, so I want you to follow my pen light without moving your head. Good. So cranial nerve 3, 4, and 6 are intact. So next we're going to do the visual acuity test with a Snellen eye chart. So I'm going to give you a Snellen eye chart. I want you to close one eye, hold it at about the distance you would hold a book, and read the lowest line you can read.
LTFPH.
Cover the other eye and do it again.
LTFPH.
Good. So that is 20/20 vision, which is a normal finding, which also indicates that cranial nerve 2 is intact. So next we're going to do the cover test. So I want you to cover your right eye. I'm going to cover your left eye. I'm going to cover my right eye. And I want you to tell me when you see my fingers.
Yep. Yep. Yep.
Good. And we're going to do it with the other eye.
Yep. Yep. Yep.
Good. So that is a normal cover test. So that's a normal finding. Next, we're going to move on to the ophthalmic exam. So I'm going to observe the inner eye with my ophthalmoscope. So I want you to look right at me. So I'm able to visualize the red reflex. His optic disc is nice and pearly, or no, not pearly, salmony pink. The margins of his optic disc are sharp and well defined. The macula and the fovea centralis are well visualized, as well as the retinal background. His vessels are nice and well visualized without any signs of hemorrhage, so that's a normal finding as well. So with that, we will move on to the nose. So I'm just going to palpate the nose and just inspect it. No signs of deformity or swelling or anything like that. Is it tender when I press?
Mm-mm.
Good. So we're going to palpate for patency. I'm going to close each nostril. I want you to breathe out. Good. So the nares are patent. I'm just going to take a look inside. So turbinates are nice and pink and moist. His septum is nice and midline and not deviated. No signs of foreign body or obstruction. So that's all a normal finding. Next, we're going to test cranial nerve 1. I'm going to have him close his eyes and identify 2 different fragrances.
Coffee.
Good.
Lemon.
So cranial nerve 1 is intact. Next, we're going to move on to the hearing portion of the exam. I'm just going to visualize the outer ear, looking for any redness or sign of irritation. Nothing is noted. Is it tender?
Mm-mm.
Good. So we'll move on to the otoscope exam. I'm going to brace against his face with my pinky here, pull back on the pinna. The ear canal is nice and patent. No signs of obstruction or foreign body. No cerumen impaction. The tympanic membrane is nice and pearly gray and translucent with the cone of light seen at 5 o'clock. No signs of bulging or irritation, so that's a normal finding. Next, we're going to do the whisper test. So I'm going to whisper a series of 3 words on each side. I want you to repeat them back to me.
1, 2, 3. 4, 5, 6.
Good. So cranial nerve 8 is intact. The next thing we're going to do is the Weber and the Rennie test. The Weber test is testing for lateralization, and the Rennie is testing for conduction hearing loss. I'm going to strike this and place it on the middle of your head, and I want you to tell me if you hear it in both ears or one more than the other.
Equal.
Good. Now I'm going to place it on your mastoid and tell me when you stop hearing the vibration.
Stop. Stopped.
Okay. So air conduction is longer than bone, which is a normal finding. Cranial nerve 8 is intact. So next, I'm going to look inside his mouth. So I want you to stick your tongue out and say ah. Good. So the soft palate raises up. So cranial nerve 9 is intact. His uvula is nice and midline. His tonsils are a grade 2. His pharynx is nice and open and patent. His soft palate is pink. All of his mucosa is pink, moist, and intact. I'm going to test for a gag reflex actually. Good. So cranial nerve 10 is intact. His teeth are intact. No sign of decay. His gingiva are nice and pink. Lips are pink, moist, without any signs of cracking or lesions. So that's a normal finding as well. And then we'll move on to the neck. So I'm going to start with the cervical lymph nodes. So we're going to do preauricular, postauricular, occipital, tonsillar, parotid, submandibular, submental, anterior and posterior cervical, and supraclavicular. Are any of those tender?
No.
And they're non-palpable, so that's a normal finding. I'm going to have you turn your head against resistance. I'm going to push on your head. I want you to turn against it. Good. Turn. Good. And then raise your shoulders. Good. So cranial nerve 11 is intact. And based on my communication with the patient, his speech and articulation is all intact, so I can assume cranial nerves 5, 7, 10, and 12 are also intact. So with that, I'm going to move on to the rest of my neck exam. His trachea is nice and midline. His neck appears supple with no bulges, masses, or signs of trauma, bruising. Skin's nice, warm pink, and intact. So I'm going to palpate. It's nice and supple. No tracheal deviation. So I'm going to have him take a sip of water while I deviate his thyroid to the left and to the right, and feel for any kind of abnormalities. So take a sip and swallow when I tell you to. Swallow. So the thyroid is not swollen, it's non-tender, there's no nodules noted. So all of that is a normal finding. So next we're going to move on to the respiratory portion of the exam. So I'm going to auscultate anteriorly and laterally and then move on to the back for the rest of the exam. So just breathe in and out for me. Good. Lung sounds are normal anteriorly and laterally. So next I'm going to palpate his spine and his intercostal spaces. Is any of that tender? No deformities noted. His chest rise is symmetrical. Take a deep breath in and out for me. Good. So again, chest rise is symmetrical with inhalation. AP lateral ratio is 2:1, which is normal. So next I'm going to test for tactile fremitus. So every time you feel my hands, I want you to say 99.
99, 99, 99, 99.
Good. So vibrations were felt throughout. That's testing for consolidation. So feeling the vibrations throughout his chest bilaterally is a normal finding. So next, I'm going to percuss. I expect to hear dullness over bone and resonance over lung fields. And I'm going to percuss bilaterally. Good. And that is a normal finding. Next, I'm going to percuss for diaphragmatic excursion. I want you to take a deep breath in and hold it. Okay, let it out. I'm gonna grab my ruler over here. Take a deep breath in and let it all the way back out for me. Good. So that's about 6 centimeters, which is normal. 3 to 5 is normal, and then 5 to 7 in athletically trained adults. So that's a normal finding. Next, I'm going to auscultate over all lung fields. So I want you to take a deep breath in and out. Good. Lung sounds are nice and clear bilaterally, so that is a normal finding. So next I'm going to move on to the cardiovascular exam. So just in inspecting him, I'm looking at his peripheral extremities. I don't see any swelling, skin color changes, his skin is nice and pink and warm, he's got even hair distribution, no dependent or peripheral edema. So I'm not worried about any cardiovascular issues or circulation issues there. So with that, I'm going to move on and listen to his temporal and his carotids for bruits with the bell of my stethoscope. And no bruits noted. So next I'm going to palpate the carotid artery. And no thrills noted on exam either. I'm going to have you lean back just a little bit. And no JVD noted on exam either, so that's a normal finding. So next I'm going to auscultate the heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And heart sounds are regular. I don't hear any gallops or murmurs. The PMI is over the mitral area. That is the apex of the heart where you can palpate and auscultate the apical pulse, and I'm able to do that, and it is normal. So next I'm going to move on to palpating and grading his peripheral pulses. So his brachial pulse is 2+ and regular. His radial is 2+ and regular. Skin is nice and warm, pink, and dry. Popliteal pulse is 2+ and regular. Posterior tibial is 2+ and regular. And his dorsalis pedis is 2+ and regular. Again, skin is nice, pink, warm, and dry. No edema or varicosities. So that's all a normal finding. So next I'm going to have you come around and lay on the bed for me. We'll do the abdominal exam. So I'm just going to observe the contours of his abdomen, noting any kind of swelling, masses, sign of trauma, bruising. I don't notice any kind of pulsations or peristalsis, so that's normal. His umbilicus is nice and midline with no bulges or herniations. So I'm just going to next listen to him in all 4 quadrants, listening for bowel sounds and bruits over the aorta, renal arteries, and the iliac arteries. Switching to the bell. No bruit noted. So there are bowel sounds in all 4 quadrants and no bruits noted over the main arteries. So next I'm going to move on to percussion. So I'm going to percuss over his entire abdominal area, expecting dullness over bone and organs and resonance over air and bowel space. And percussing for liver border, starting from dullness to resonance and up from resonance to dull. And liver span is about 10 centimeters, which is a normal finding in an adult male. Next, we're going to move on to light palpation. Is any of that tender? Good. And then moving on to deep palpation, where I can expect to palpate the liver. Take a deep breath. And I do not. And then where I can attempt to palpate the kidneys, which I do not, and the spleen, which I do not. It's easily palpated in a thinner adult and children. So that's all a normal finding. So while you're laying right here, I'm going to move on to the musculoskeletal exam. I'm going to palpate his femoral pulses, which are 2+, and then palpate for any inguinal lymph nodes, and I do not feel any. Is any of that tender? Good. I don't see any deformities in his hip bones. Can you raise your leg out to the side for me? Good. No crepitus noted on exam. Straight lift up. Okay, bend your knee to your chest and rotate your leg over that way. Good. Full range of motion on his hip. No muscle atrophy noted. No crepitus. So all of that is a normal finding. Come on back over here. We'll sit on the bench and finish up your range of motion. No swelling or crepitus noted on your knee. Can you raise your leg out for me, move it around? No crepitus or swelling. I'm going to try and pull your leg out, don't let me. I'm going to try and push your leg in, don't let me. Good. Can you roll your ankle around? Inversion, eversion, good. So no crepitus or swelling noted there. I'm going to try and push your foot up, don't let me. And I'm going to try and push your foot down, don't let me. Good. So no range of motion loss or crepitus noted there. 5+ strength with no muscle atrophy noted. We're going to go up to your shoulder, do the same thing, kind of spin your shoulder around. Good. No crepitus noted on that exam. I'm going to try and push your arm down, don't let me. I'm going to try and push it up, don't let me. Good. 5+ muscle strength there with no atrophy. No deformity or swelling over the elbow. No tenderness. Can you move your arm up now? Good. No crepitus there. I'm going to try and push your arm up, don't let me. I'm going to try and push your arm down, don't let me. Grade 5 strength there. Can you roll your wrists? Do this with your fingers. Good. Good. Ulnar and radial deviation intact. No crepitus or swelling noted there either. So all of that is a normal finding. So while we're at it, I'm going to move on to the deep tendon reflexes. So we'll check the brachial. Little twinge in the fingers there, so that's a 2+, which is a normal finding. Sit back a little bit and I'll check your patellar. Little twinge there, so that's a 2+, which is normal. And 2+ for the Achilles, and I'm going to run this along the sole of your foot. And the toes curled in, so that's a normal finding. We'd be looking for the toes to splay out, which is abnormal. So next, I'm going to have you close your eyes. I'm going to place place an object in your hand. I want you to tell me what it is.
It's a paperclip.
Good. So stereognosis is intact. Next, I'm going to touch you either with this toothpick or with this. I want you to tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. No sensory loss there. So next, I'm gonna have you move your fingers back and forth, touching your thumb as quickly as you can. Good. And then I'm gonna hold my finger out in front of your face, and I want you to touch your nose and touch my finger as quickly as you can. Good. Switch your hands. Good. Can you tell me your name and date of birth?
Sean Boudreaux. 7/24/93.
What year is it?
2021.
Who's the president?
Biden.
Good. What do you do at a stoplight?
Stop.
What do you do at a green light?
And go.
Good. So judgment is intact. He's alert and oriented times 4. So next we're gonna have you do this last rapid alternating movement on your legs. Do this back and forth as quickly as you can. Good. And then can you take the heel of one foot and rub it up and down the shin of the other leg? Good. Other side. Good. Next I'm gonna have you stand up, close your eyes, and hold your arms out. Good. So this is the Romberg test. He's not swaying, so that tells me his balance is intact. Good. So you can stop doing that. Hop up and down in one place. Good. Balance intact. Next, I'm going to have you walk from here to there just normally. Good. Now walk back heel to toe. Good. Now walk back one more time. Halfway through, walk on your toes. And then switch to just your heels. Good. So with that concludes my head to toe assessment. Those were all normal findings.